Okay, so I'm going to be doing my newborn assessment. So when the baby first comes out, I'm going to check the airway, check breathing and circulation. I'm going to suction the mouth, and then I'm going to suction the nose. I'm going to dry my new baby and wrap her in a blanket, and then I would apply my bracelet. Then I'll do an APGAR test, and I'm going to check the heart rate, and it needs to be greater than 100. And then I'm going to check respiratory based on if it's absent, slow, or if it's like a good cry. As for muscle tone, I'm going to check and see if my baby's flaccid, if they're like flexion or like well flexed all over the place. I'm going to look at irritability, so if there's none, that's not a good sign. A grimace, and then I'm looking for more so a cry, so I can give them a score of 2. And then I'm also going to check like the baby's overall color. If they're completely blue, that's not good. If they're pink with like cyanosis on the fingertips, that's it's not the worst, but it's okay. And then if they're completely pink is technically what would be a good sign. As far as medications, I'm going to give my baby antibiotics in the eye, a vitamin K shot, and then their Hep B vaccine, and then if it's needed, I would give the Hep B immunoglobulin. Then I'm going to after that, I would assess the airway, heart rate, color. I'm going to make sure that my baby stays warm. I'm going to check vital signs, so again, heart rate and respirations. After that, I'm going to check the baby's length, weight, head circumference, and the chest circumference. I would kind of just like measure across the chest. As far as the head, I'm going to be checking for the fontanelles, anterior, posterior. They're going to be check for any molding on the head, any signs of cephalohematomas. After that, then I'm going to move into the eyes. Looking into the eyes, I'm going to make sure that they're not crossing over. I'm going to check for scleras, and I am going to see if there's any signs of jaundice or hemorrhage that's present. Any green or yellow discharge in the eyes could mean that there's an infection. I'm going to then move into the eyes, the ears. So the pinna should fall from the end of the eye, should turn to the pinna, and then I'm going to see if there's any defects or any like tags or dimples around the ear. And then I'm going to go down into the nose. For the nose, I'm going to make sure there's breathing, so I want to make sure that both of the nares are patent. After that, I want to just make sure that there's no signs of respiratory distress in the nasal of the baby. After that, I'm going to check for the mouth. So I want to make sure, I'm going to check for Epstein's pearls. I'm going to check for any natal teeth. I'm also going to check the palate, soft and hard, and then just make sure that the tongue is moving freely. With the neck, I want to make sure that the trachea is midline, there's no palpable masses, and there's no webbing or clavicle fractures. From the chest, I'm going to check circular appearance, check the nipples and make sure they're kind of symmetrical, and I want to make sure that there's no discharge on the nipples. With the hands, I want to make sure that there's no presence of polydactyl or syndactyl, so I want to make sure there's 5 fingers on both hands, and that there's that crease. I want to make sure there is the presence of a singular palmar crease. As far as color, I want to make sure that the color is appropriate to the ethnicity. I want to check for vernix and lango, which is like furry hairs on the baby. I want to see If the skin is dry and peeling, I want to check for acrocyanosis. I also want to check for any signs of ecchymosis, petechiae. I want to examine the baby for birthmarks, if any, arrhythmia, toxin, arrhythmia, toxin. And then I also want to notice if there's any mottling on the baby. While I'm checking the skin of the baby, I'm going to check facial marks that may be seen that maybe have been caused by the forceps. I also want to check for vascular birthmarks. If there are any, I would assess for color, whether they're flat, raised, where they're located, and if they blanch or not. I also want to check for nevus simplex, so any stork bites, angel kisses, any of the nevus vasculus, which are like strawberry marks. I'm just overall examining the baby all over. So we check the birthmarks. The birthmarks can be Mongolian or cafe au lait spots. We'll go down into the abdomen, so we're going to check the umbilical cord. So we're checking 3 vessels, 2 arteries, and 1 vein. We want to check the shape, and I'm going to go down and check the genital. This is a female baby, so I'm checking for the labia edemosus. It may be present, sometimes it's not. And then I will go into the spine of the baby. So I want to make sure that it appears straight and intact. I also want to check for any dimpling or tuft hair at the base. After that, I'm going to check the extremities of the baby. So I want to check for full range of motions. I want to make sure that it's symmetrical. I want to check the creases in the feet. We'll do the Artelani or the Barlow's test. I also want to kind of like Babinski, also checking for acrocyanosis, any club feet. I'm going to check again cardiovascular like we did in the APGAR. So I'm going to check the heart rate of the baby, listen for heart sounds, any murmurs. I'm going to check the pulse, the strength of the pulses on my baby. We'll check brachial pulses. And then we will check respiratory rate, also rhythm. As far as the GI, we're looking for any signs of jaundice, any signs of bleeding, also signs of hypoglycemia. So the blood glucose should be between 40 and 80. We're going to check the patency of the anus, and we are going to listen for bowel sounds. And then I will move on into the neurological systems. So I want to see if my baby is alert, reflexes. I want to check for postures, whether they're crying. I want to notice the muscle tone and motor activity. So I've already checked the fontanelles and the head size. I want to make sure my baby's not jittery or showing signs of any hypoglycemia as an infant. I will do things like check for rooting and sucking. So I'm going to kind of like touch the cheek and see if the baby comes over towards where I'm touching or stroking. And then I also want to put my finger near the mouth and see if the baby sucks on it. I want to check times for sucking and swallowing. I'm sorry, I want to check for swallowing and make sure that the baby is swallowing properly. As far as reflexes, I will do the Moro, which is like making a loud sound, just making sure that the baby reacts to it. As far as the baby, while the baby is supine, I would do the tonic neck. So if I turn the head to one side, the arm on that side should extend and the other one should bend. And then as far as the Babinski, I'm going to stroke the sole of the foot and the toe should curl over. And then if I place my baby on the abdomen, the baby will try to crawl. And that is my newborn assessment.